Hi, Sushrut. How are you doing?
Hey, nice to meet you. Good morning.
Very nice to meet you as well. Thank you so much for taking the time. We really appreciate it. Can we just
Yeah,
start off by stating
of
your
course.
name and which rotation you recently just completed?
Yeah, so I'm Sushrut and I just completed a rotation in Maryland. It was a 1 month long rotation in internal medicine.
Great. And did you do any other rotations via med clerkships?
Yeah, I did another one as well. Right before that, I did a 1 month internal medicine rotation in New York, Brooklyn.
Great. And can you describe in as much detail as you can your overall experience in the rotations?
Yeah, so setting up and getting to rotations was a really streamlined and good process, and med clerkships helped me each step along the way. And it was uh, it was without any resistance that we could just start on day one of the rotations. The mentors that we met were really cool. They were good to get along with, and they were more than just physicians. They did take genuine effort to be mentors to us and teach us how the system works.
That's great. And do you feel that your preceptor worked well with students and it was a highly educational environment?
Certainly, yeah. I feel that there was a lot of opportunity for learning, a lot of opportunity to take advantage of, you know, learning how to use different EMR systems, for example, coming across patients of different socioeconomic backgrounds and getting to network a little bit with the doctors.
That's great to hear. And can you describe your individual experience with your preceptor?
Yeah, sure. I'll start with DC. So, yeah, Maryland. Yeah, so that was a 1 month long process where we saw all kinds of patients with Dr. Gill, and she'd regularly let us take our own histories and even do a mild exam under supervision. And she would let us come up with our plans for the patient, what kind of care we would provide, what management we would prefer to provide. And she would, of course, check it against and teach us where we could improve, how this could be better. And it was overall very educational and somewhat hands on.
Very nice. And how would you describe your experience with med clerkships?
Right. So overall, I spent something like 2 months actively working in these rotations, and I guess a couple of months setting them up and planning for it. And overall, I'd say my experience with my clerkships has been pretty good because they made various, this whole process is pretty vague and confusing, and they help clear it out. They're always quick to respond and figure out what the issue you're facing right now is and give you options and give you a little guidance. So I really appreciate what they've done in that regard.
Very glad to hear that. And would you recommend med clerkships to other students? And would you yourself do another rotation through med clerkships?
Yeah, absolutely. I've got several juniors who are lining to get their own rotations and such now that COVID has cleared up. They're looking forward to it. And I have suggested that, I got a good experience to med clerkships, and I hope that you guys do too. I myself would be happy to continue trying other rotations after this current math cycle, um, after applications.
Okay, great. Thank you so much again for taking the time to do this, Sushrat. We really appreciate it.
Yeah, of course. Thank you.
And we wish you the best of luck.
Thanks. Good luck to you.